I think they mean antenatally.
Yes, antenatal expressing at the earliest after 36 weeks. And we have to tell the mothers it's only hand expressing. They don't use a pump before the delivery. And they can learn from their lactation consultant. Sometimes antenatal problems, the nipple related problems may get better with this as well. They will need to store. Initially, they may get just 0.5 to 1 ml. And up to 3 expressions can be stored together. You can keep it in the fridge and combine them and freeze them. So you don't need to store every 0.5 ml separately in a syringe. So you can go through the guidelines. I have shared it in the MH group recently, and maybe Dr. Neha can post it for everyone who's attending this session. This is from Breastfeeding Society, and obviously the guidelines can be shared. How much to give? Obviously, the newborn baby's stomach is small, and it's a very interesting point. In terms of, I'll make it here because we still have 5 more minutes. In terms of the baby's feeding pattern, nature has evolved in a way. The breastfeeding doesn't go from 0 to 60 in one day, the volume per feed. But when we are giving the formula milk, or when we are giving additional support, we expect to give 30 ml on the first day, 60 ml on the second day. So breast milk actually only increases, say, 5 to 10 ml on the first day, and the baby starts getting 20-30 ml by 3 to 4 days. And if a mother is expressing like 25-30 ml by third day, we are very surprised, because that's a good volume. And that's what the baby is going to get when they feed. And there is a reason for this. It's related to epigenetics. It's related to pre-programming. So if you give too much too early, the epigenetic expressions change, and it may lead to higher risk of future problems like obesity, diabetes, and so on. The other important problem, the immediate effect, is that the lactase enzyme is not well developed in the newborn. And once the milk lactose gets exposed, there is upgradation of this enzyme level. Upregulation happens. And over the first week, the enzyme gradually increases. So the load that the baby is exposed to should be gradually increased. So even if you are giving top-up feeds for any reason, don't give the prescribed volume. We are aiming to give fluid balance of 60 ml per kilo per day on day 1 by tradition when the baby gets admitted to the NICU. But when baby is on feed, you don't necessarily need that unless the baby is hypoglycemic. So the hypoglycemic babies are different, but other babies, you don't need to top up a big volume. Just top up enough to keep the baby comfortable and encourage the breast milk expression. And many nurses have made an observation, interesting observation. I think it was Rosa in our team who made that. She said if the baby is hypoglycemic, we give formula, and then these babies get nappy rash by day 2-3. So remember that when lactase enzyme is deficient, the lactose doesn't get digested well. You get acidic stools. So you get more of nappy rash in the early stages. And these factors also aggravate the baby's colic coming on early. So many factors. The mother-infant interaction, the cues. One of the most important things that the lactation consultant stresses on is the cue-based feeding, but only nature can teach us what the actual cue-based response is. Because if we are over-stressing on responding to the cues quickly, we may be overdoing it. And breastfed babies can be overfed as well. In the multigravida, for example, who has enough milk, you may start overfeeding the breastfed baby, and the same problems can happen in a breastfeeding baby. The baby cries because of discomfort. We end up feeding them again, and it's a vicious cycle, and reflux also sets in as a complex. So it's a close interaction of these factors. So allow nature to progress. Don't intervene too much. Support the mother as needed. And don't worry too much about how much you are giving, as long as the baby is physiologically stable. And the weight monitoring as well is very important. Some weight loss is normal, and after that, the weight gain should progress, but at a normal range. That's why we should start discussing with the families about percentile-based growth patterns. Teach them that each family doesn't grow the same way. Any mother who ends up with formula feeding their baby, they see the tin and they say, baby has to get 240 ml by 3 months. None of your babies will take 240 ml in 3 months. The formula company wants to sell more. That's where they're writing to overfeed. And remember that after the baby starts weaning, you should reduce the milk intake. So all these healthy practices should be encouraged. And obstetricians, there is no harm in knowing more about the baby care as well, because all of us are advocates for the family health in the long term.